Well, hello, GinaMarie.
Hey,
Welcome.
Ron.
Nice to meet you. Nice to have you here. We're excited to be talking to you.
Good to see you.
Yeah. Well, hello, everyone. Welcome. My name is Dr. Ronald Asimwe. I am an assistant professor in the Family Social Science Department here at the University of Minnesota, where I teach classes in family therapy and family social sciences. Today, I'm excited on this channel to be hosting a very good colleague and friend, GinaMarie Russo, to be talking to us about how she's been able to adapt IFS, that's internal family systems model, and EFT to her unique context. And so I have a brief bio here, so I'm going to introduce her. GinaMarie Russo is a licensed marriage and family therapist, so LMFT, and mental health counselor in the state of Florida. She is a dedicated educator and currently completing her Ph.D. in counseling and counselor education at the University of Florida. With expertise in MFT and counseling, early childhood education, and special education, she integrates clinical experience and academic knowledge to address the unique needs of clients from diverse backgrounds. GinaMarie specializes in trauma-informed, attachment-based approaches with specialized training in emotional focus therapy, what we call EFT, internal family system theory or system theory, IFS, and Enneagram. Wow, it's good to know. Her clinical interests and expertise include the intersections of neurodiversity, attachment and trauma, and their effects within clients and their relationships, particularly for LGBTQ plus identifying individuals. Currently, she works as a clinical case manager at the University of Florida's Counseling and Wellness Center, where she supports the mental health of some of the campus most vulnerable students, facilitates workshops, mentors trainees, and leads the Center's first neurodiverse and trans intersectionality group. She is an active contributor to the counseling field, and she has co-organized the formulation of AMFT's Neurodiversity Tropical Interest Network. Wow. And currently serves as the secretary for this Tropical Interest Network. She recently co-presented on neurodiversity at the Systemic Family Therapy Conference that recently concluded in Orlando, Florida. And personally, I had the opportunity to sit and learn from her and her colleague, which made me want to invite her to talk to us about her work. Her work emphasizes inclusivity, empowerment, and fostering connections in therapy, education, and advocacy, particularly for historically marginalized clients and populations. Welcome, GinaMarie.
It's so awkward hearing your own introduction.
Right, right, right. It is always awkward when bios are read and it's like, oh, is that me?
Yeah.
So listen, I'm very excited to host you. You and I have had these conversations about therapy and IFS, and the purpose of really this interview, in the next few minutes, we'll be talking about, historically, we know that in our field, we have had in our field, I mean, the MFT training field, we have the so-called master's training videos. And if what you and I were to be honest, is that those videos were shot and recorded in the 70s and 80s when the field was growing and developing. They were great. They're still great resources. But as years have gone on, we're seeing diverse families and clients and therapists. And we realize that these training materials really do not represent a lot of the therapists that we're training. And so my goal and our goal for today is to really talk to you as a contemporary family therapist who is working with diverse individuals. How have you been able to adapt models like internal family systems therapy, IFS, and EFT into your work? So that's the goal for today. And I have a series of questions here that I'll be asking you, but this is conversational, so let's get going.
Sure.
My first question is really for our audience. I would like us to know about you, so tell us about yourself. Please feel free to share any parts of your identity that you're comfortable with, and then we'll get it going.
Yeah. I love that you start with this question because I think even in the bio, like you hear all the letters and the things that people are doing, but it's like, who is the human sitting
Yeah.
in front of me? And broaching that is so, I think, essential to understanding the worldview that
Mhm.
someone's coming from. So I identify as a queer polyamorous woman. Currently, anyway, we're kind of in the questioning sphere of around gender right now, but we'll get where we get eventually. I'm 38, so I'm middle-aged, I guess. Mom, I've got 2 kids, multiple divorcee, also a marriage therapist, which I think blends really beautifully in the work that I do. Generally, like, was raised middle class, upper middle class, and I've stayed, within that kind of like class structure for my whole life. So I do understand the mass amount of privilege, especially as someone who holds 4 degrees from the University of Florida. I also identify as pagan or spiritual, and kind of like, I kind of hang out in a lot of different learnings and teachings about spirituality and things like that. So I don't ascribe to one particular doctrine. I'm kind of learning and like to take from a lot of different places of wisdom that aren't just, one of the 3 or any one particular area. Also Italian Irish, like 2nd generation American. So kind of white, new white to America, from New York also. So that has kind of formed a lot of my identity as well, being raised up north and then coming out of the south.
Wow,
Yeah.
that's beautiful. I didn't know that part. New York to Florida.
Mm-hmm.
How old are your kids?
12 and 14.
12 and 14. Wow, they are in their teen ages, fun age.
It's so good.
Yeah. Well, thank you, GinaMarie. Well, I'm interested in hearing about your story of being in the therapy field. How did you choose to be in the mental health field and particular interest in couple and family therapy?
Sure. So previously, this is actually my 2nd career. I was an educator before. So I graduated from UF with an early childhood education, master's degree, special ed bachelor's degree in 2008, 2009.
Hmm.
And I had my daughter soon after that, but I worked in preschools. I had worked with little kids, like 0 to 5 years old, from the time I was in high school. And then I had my own kids, and then I was working in like public and private and charter schools all around the Jacksonville area. And there's a particular story of one day I was working at the first ever charter school in Clay County, where they have a very large, like, poor population, and then there's 2 Navy bases here, so there's a lot of military. There's like a lot of cultural intersections in the area. And there was a day I was in my 2nd grade class, and I had 3 different kids underneath their desks, all crying at the same time about something that was going on. I was trying to teach like multiplication. And I just had everybody put their books away, and I sat under every single desk, and I just talked with the kids and calmed them down. And we all got up, and then we went to the playground and like just went the rest of our day. And I went home, and my kid's husband at the time, I told him the story, and he's like, Gina, you're just doing therapy. Why don't you get paid for it? And so
Wow,
I was like,
so validating.
right. And then I'm like, but then I got to go back to school. And he's like,
Yeah,
yeah, but that's what you're doing. Like, you
yeah.
should you should go and do that. And so, I started on the journey of like reading about it, and I was like, this definitely feels like the right thing. And so I went back to school in 2018, graduated in 2020. And it was definitely like the best decision that I have ever made in my life. It is exactly the right work that I want to be doing with people, for like of all developmental ages, and like in all the different kinds of ways, between working with couples and individuals and with communities and groups. It's really incredible.
What an incredible story. Wow. So you've been in the field for quite some time now.
Mhm.
What models influence your practice and why do you practice according to this model or these
Yeah.
models?
Yeah. Well, like you were saying earlier, IFS and EFT are my 2 main modalities that I am constantly kind of like bridging and intersecting with each other, as like a systemic theory working with an individual theory, like in connection with each other.
Hmm.
And a lot of me sees these 2 theories as kind of like the same thing, but talking about stuff in different words. They really like layer beautifully with each other,
Hmm.
to be able to get into someone's internal world with IFS and learn how their parts are interacting with each other, and then how people are are dancing with each other attachment wise in their relationships, and how they're contextualizing their relationships in their world. It just all makes a lot of sense to me. And working with EFT and doing the work in that world and doing emotionally corrective experiences with people, it has been really life-changing. I've had it happen for myself. I've done EFT and IFS therapy personally, a lot of trauma therapy on my own. And then doing it with clients, it's just been really powerful how you see people just kind of change very naturally and very beautifully.
Yeah, I love that. I love that you share that too, and thank you for sharing that with us. That you've also experienced these models that you're learning and practicing from. It's not just you learning the knowledge and the head knowledge of a model, but that you have experienced them yourself and you've seen the power in these models. Can you talk a little bit about, do they require specific training? And also, if you could talk about what kinds of clients or problems do you work with?
So to answer the specific trainings question, they do, like everybody has their, EFT training and IFS level 1, 3, whatever.
Hmm.
If you want to be like able to identify yourself as a certified therapist. I haven't done any of the IFS there, like the official ones, because those are like $3,000 and almost impossible to get into.
Yeah, yeah,
They're
yeah.
wildly expensive. But I have done some, like Richard Schwartz, he did some trainings over COVID virtually, like couples trainings. And so
Hmm.
I engaged with that and a bunch of other um, IFS trainings on like some of the CE websites that were really good. And my supervisors all knew IFS too. So we worked through IFS supervision, which was really useful for me.
Yeah.
Um, and then EFT, I do have training in EFIT, so the individual therapy version. I have up to level 2
Mm.
training for that. And then I haven't done the full level 1 of EFT training yet, but I am like in that part of the pathway for EFT.
Right. That's beautiful. It's beautiful.
Much more reasonable, especially if you're a student. The
Yeah.
discount really good. So highly
Yeah.
recommend
Right,
students out
right. Yeah.
take
It's I
advantage.
took a Yeah, I took advantage of those student rates too. They're always amazing. Um, so what kind of clients do you typically work with, or what kind of problems? Are there any specialized problems that you work with? Account configurations?
Yeah, so currently I work in collegiate mental health. I work for the Counseling Wellness Center at UF. But prior to that, I was working in community mental health at a not-for-profit in Gainesville. I started and ran the playroom in that place. So I worked with kids and their families. I tend to just kind of get a lot of neurodiverse clients that some I think we like receive the clients that we're supposed to receive. I believe that very firmly. And those are who tend to like arrive in my office, like undiagnosed, like adult women, ADHD, autism spectrum tend to come. Like I'm like, I'm really curious, and we tend to do a lot of kind of conversation. And then the kids, especially young boys with ADHD, and their families tend to find their way to me, and we do a lot of work within the family. And I'm noticing that in my collegiate clients also, a lot of like multiple exceptionalities. Like we've got like ADHD giftedness and some autism spectrum, and then kind of what is it like to be you in the college setting. Those tend to be a lot of the conversations, and like unraveling all of the like systemic narratives of like shame, how you're supposed to be able to do things, and like trying to find our ways, like peeling off all of those shells and just being able to be a person, not burning out,
Yeah,
right, in the world.
yeah.
So
Love that. Love
that was my
that.
dream. I'm also definitely somewhere on the neurodiverse spectrum. I didn't say that in the beginning because I forgot. I'm
Yeah.
not officially diagnosed with anything, but my dating life and just how I behave, it would definitely indicate that that is true in some way.
Well,
So
I appreciate you sharing that part of you and just the vulnerability in it. Could you share with us? So you talked about how you beautifully weave IFS and EFT together. Could you describe, and you could base it on either model, you could base it on IFS or EFT. Could you describe a well-known intervention from your theoretical base And if you could talk about what is the purpose of this intervention for our viewers that are maybe learning these models, how successful is it? When do you use it and when do you not use it?
Mhm. I have found, so within the IFS model, the parts mapping, so orienting someone to like arrive in the room and like, who are you?
Mm,
And being able to take the time using the EFT attachment language and the attachment frame so that someone can settle in and feel safe enough to really do some deep exploration and just find, who's hanging out, who's in here, who are my protectors, who are they protecting, like what's going on, and not in like an I'm intellectualizing kind of way. I'm really understanding myself and how are my parts in relationship with each other and where do I feel them in my body. It's like a very somatic exercise. It's an emotional exercise and an intellectual exercise. And it's relational because I am saying that I see you. And I think for especially our historically marginalized populations and our communities, like the LGBTQ plus community, neurodiverse community, like being perceived is exceptionally terrifying.
mm,
So when I can be perceived and it feels safe and loving and or just neutral, like, oh, I just noticed something, what is that, and I can just be with that.
mm,
um Parts mapping, I think, can actually be one of the most powerful tools
mm,
in my tool belt. And then the clients kind of take that and explore with it very naturally. And we do this really cool like boomerang with each other. And that's where the EFT dance comes in. We
yeah.
start to tango with each other, where they start really kind of like diving into their emotional process and sorting out themselves. And then I can reflect and mirror who they are and how they're expressing back to them. And then we can really walk with their parts together. Um, and I have more so with my diverse clients, but this is with everyone. I really feel like these two theories are really applicable. It's just so human.
Ah,
We all
yeah.
have nervous systems, right? Like
Right, right.
we're all have nervous systems. We all have relationships, and we're all in these really weird bodies, like
Yeah,
trying to be in the
yeah.
world. Um, but there's something about the like eliminating the shame and the rejection sensitivity of being seen that for LGBTQ plus and neurodiverse clients is exceptionally powerful.
I love that. I love that. And I love that you say that everybody experiences this, and you're right. I think at the core, and this is a beautiful thing that many people that love attachment have connected with. I've connected with attachment. The idea that we all long to be seen, heard, and validated. And I love how you beautifully described the integration of EFT in the EFT world. They'll talk about this idea of it's intrapsychic and interpsychic, meaning you start with working with individual and then you go between, within and between. You
Mhm.
see what's happening in the individual and how is that interacting, how they are dancing or how they're interacting with their partner. And I love that it sounds like your best is you start with the IFS, the parts mapping, which I love, and then seeing how those parts are dancing with each other and then how they're in the broader interaction or context with their partner or
Mhm.
partners, how they're doing that. I love that. I think that's very beautiful. Could you
Mhm.
briefly describe the IFS parts, like in the I don't know, simplest way, sort of for our viewers? Yeah.
Yeah, yeah. I love like the briefly. So in IFS, there are like three, there's two main parts, but one of them has two kinds.
Mm,
And then the self. So the self is the thing that's more than all of the parts.
mm-hmm,
And so outside of that, we're broken up into protectors and exiles. And so exiles are the parts of us that are like kind of holding on to our trauma. Like they're the parts of self that popped, like when we couldn't um, be in the situation anymore where we had to like leave ourselves, leave our consciousness. They're the parts that popped off. And usually they say like these parts are like between the 0 and 8 years old, generally. And they're kind of like held over here, like Penelope von Sweet from Wreck-It Ralph, if this is a cultural reference anyone understands, like her. And then there are protectors, and there's two kind of protectors. There's managers and firefighters. So managers work really hard. If anybody has seen Inside Out 2, they work really, really hard to make sure everything is okay so that the exiles never have to feel the experience of the vulnerability that happened in that moment. So they're really trying to keep things very contained. Managers are beautiful and dangerous at the same time. They're doing this kind of multiple like restriction, but for like, because I don't want to feel that, we don't want to feel that pain, right? Firefighters are the ones who, when the child erupts, when the exile erupts, because it will, because managers cannot work hard enough for that to never happen. We're going to get triggered. They douse the flame. So they're the ones, like we can look in like in addiction, dissociation, disordered eating, self-harm, even like doom scrolling, right? Can be a dissociative firefighting mechanism, perfectionism as well. And so all of these parts are in relationship with each other, and they kind of form an internal family. That's why. And then we got a lot of families, we got neighborhoods, we got countries, we got some of us our systems are so complex, and they're all interacting with each other, and they have feelings about each other, and they don't like each other sometimes, or they're aligned with each other. The same things we see in family dynamics out in the world, you see internally, which is pretty crazy and awesome.
Yeah. Wow. Thank you for giving us that summary of the parts. It's interesting how I've always found IFS very fascinating to even understand our own selves. I mean, all our family therapy models are great to understanding ourselves, but the models that go deeper in talking about attachment and how parts really operate with each other. Thank you. So you talked about one intervention, parts mapping. Could you give a model specific example? Could you give us a specific example of a client you recently worked with that you could remember, of course, keeping confidentiality in mind, using this intervention or any of the other interventions, and how it worked for your client?
Yeah, sure. I actually had a client today that I saw,
Great. It's
yeah,
fresh.
perfect for the situation.
Yes.
Um, we do a lot of really beautiful parts mapping. This client, they are a freshman, no, junior. And just beautifully like intersectional, non-binary, queer, I think they're diagnosed autistic, but definitely neurodiverse in some way. And so and they're very creative as well. So they exist in this like very emotionally fluid like world. And they have some autism spectrum traits, which they're like, but I need rules and I need structure. So we're
Yeah.
constantly kind of like doing
Mm.
this internally with each other. And today we did some parts mapping of, we found some protectors that were, we realized had a big wall in between the two of them. And the way that we did that, we go into a lot of metaphor and analogy and felt sense in the body. So as we're kind of exploring, and like images will come to mind or a felt sense in their body will come up, and it's like, okay, well, what was that and who's that connected to, do you think? And we'll kind of like explore verbally a little bit, and then they'll be like, oh, but I hear from the other one, like I'm getting this other experience of this other energy. And it's like, cool, can we talk about that, or can we talk into that? How does that part feel about getting a little bit closer? Always asking for consent when we're working with parts and parts mapping, especially because with parts mapping, you're usually getting to know parts that have never known the self before. Like they don't, or they know you and they don't like you because you went away. So they have like really negative, they can have negative feelings towards the self giving them attention. So we're looking for consent. And one of the things with parts mapping that's really, really important is to have absolutely no expectations of what's going to happen, because the story has to unfold very naturally. So the question of like, and what happens next? Or like, what's the next thing that you hear? Where's the next place to go? I think I asked today, like, what's the next right thing to do? I asked that a couple of times today. And they were able to like kind of feel into their nervous system and be like, I have all these different things going on, but I think the place that needs the most attention right now, and this is where attachment came in, the part of me that needs my attention most right now is this one. And so then we went into exploring, okay, well, what does that part need from you? Like, what would they like? How would they like that relationship to be? Do they just want you to sit with them, or do they want you to listen or go away? and they were able to have like an inner dialogue with that protector internally, and like formulate a plan of connecting over the next week or two. And then we're going to come back and just check in and see what's happening there. And that's like, as we're mapping the parts, you can, like, there was another protector that showed up in session as well. And we were able to ask it, like, do you need to hang out, or can you give us some space to like talk right now? And they were like, it's okay, you guys can keep talking. And like, it just occurs in this way. It's very fascinating. Like the permission that if you just give it permission to flow, it will flow.
I love the term you're using, giving the parts the permission.
Yeah.
Such a beautiful way you describe this intervention and the work that you did with these clients. It's amazing. Thank you for sharing with us that beautiful example. It's in the moment and it's today, so it's still very fresh. Um, are there any contextual challenges you face in practicing according to the IFS model?
Contextual challenges, as in, what do you
Like,
mean?
let me expand on this. So maybe there are people who will say, like, oh, this model maybe does not work well with X type of clients,
Mhm.
or you face some clients who push against what you're trying to do, talk about the parts. I remember when I was learning IFS, I tried to use it with a client who was not from the US, and they told me it seemed like witchcraft, like there was that point like like this is weird. I'm trying to talk to this part and it's all within me. They could not wrap their mind around that, and so there was that tension and resistance. And
Mhm.
I stayed with them. I validated the resistance. So that kind of challenge. Are there any challenges that you could think it could be?
Yeah, what you named, I think I have experienced that with clients too. And when I was early in utilizing the theory as like a cognitive process versus a
Hmm.
therapeutic process, um, that was harder to navigate. But so for me, I don't, kind of like with EFT, like the goal as the EFT therapist is we're not explaining to them what we're doing. We are dancing, right? Like we are in the
Yes.
dance with them. And
Yes.
IFS is very much that way also. I believe it's
Hmm.
like infidelity. It should be that way. And there's psychoeducation, of course, to teach the people, especially like the more intellectual, like logical people, need to understand language and terms. But we can also just stay with emotion and validate resistance, but internally to myself, staying in like I believe deeply in these processes. And it's information for me if resistance shows up, or if they lean in like a whole lot to the process, that's also information for me. It's more about like how I'm tracking the human and engaging with them. That's why I like the EFIT.
Yeah.
Um, and it lets it roll easier.
Yeah. Yeah.
I know within certain cultures too, there's like an even bigger stigma against like the idea of breaking yourself into parts for like schizophrenia, or like the
Hmm.
hoodoo voodoo kind of like things. And so being careful with like language around that, and like respecting like the cultural implications and what that means for that client, and using whatever language is comfortable, because the words I don't think actually really matter. It's the concept and the tone and the healing that matters. So if you can find a way to talk to someone about it and utilize it, then
Wow. I love what you just said a minute ago that resistance is information. That's pretty
Mhm.
powerful. That even when you sense the client is resisting the intervention you're trying to do, mostly it's some of our intellectual clients. It's really not that they're resisting. They're giving us information about where they are in the process, and these models are good at allowing you to hold them in that space and meet them there. I love that.
I had a I guess she was a professor. She was also my supervisor during my registered internship. And one of the things she said when she was teaching was, everyone has a really good reason for showing up exactly how they are.
Hmm.
Every single human
Wow.
being, right? And like, if you can keep that center as a clinician, you can
Hmm.
engage in it with anybody because you're always curious. And
Wow.
I think EFT and IFS give us the opportunity to do that because they're not diagnostic. They are not saying there's something wrong with people. They're saying there's something happening within or around people. And
Mm.
are we able to be curious enough to step into their process and understand them?
Wow, those are powerful words. You've learned from some great mentors, my
I
friend.
have. I
Uh,
agree. Yeah.
wow, I'll have to sit with that for a moment. Hmm. Okay, well, so then, oh, thank you. I'm still I'm still in that
Doubling.
experience. Yeah. Do you have so for people who are some of the students I teach are learning family therapy for the first time. Some have been exposed to family system theory. Do you have any advice for students or people out there that might watch this interview that are
Mm,
interested in any of these models, IFS or EFT? That you could give them. They're interested, but then maybe they don't know where to go and how to start. Some are like, this feeling thing is weird. I
yeah.
was in that bus when I learned EFT the first time. I was like, this is crazy. This is wild. I don't like it. And now I'm like, oh, I love the model. So, any advice for people that are on that spectrum?
Sure. I mean, the first thing I would say is if it doesn't resonate for you, it's not for you, and that's okay. Like if you are to grow into it, like you, Ron, and like me too, like we'll grow into the things that we're made to be growing into. And so if we're not built to be within these models, completely all right. There's nothing wrong with you, like because you're not doing the new cool thing. Um, if you there's a curiosity and like a where do I find good information? Where do I find like quality resources and things like that? Most areas in the country, especially with EFT, have like hubs of where you can like go onto the, I think it's like ICEEFT or something like that. And you can find trainings and great resources and stuff online, and little communities within the area of where clinicians meet and they do peer support and they are talking about cases together. And we have one in Tampa, the Tampa area that I've been connected with for a little while. Um, so very much encouraging you to explore outside of like a little silo and like poke around the internet, and see who's around. Also, for me, in both of these things, like in exploring, it was a person who I trusted and was very safe to me, and I like believed in, uh, believed in it.
Mm.
So it was easy to be like, even if it felt weird, because some of it felt really weird, but like clearly it's meaning something to this human being who is such a powerful role model for me. Um, and that like I could ask them some questions and like it's about in the connection of like, well, where did you do your training? And like, what does that word mean? Like where you can feel a little bit stupid with somebody and it be
Yeah,
okay.
yeah,
Um, that I think is like the most useful entry point into a lot of the any domain that we want to go into, but these in particular, because they're very vulnerable.
yeah. I
And
love that.
I'm happy to share resources with any of your students also. Like
Uh,
put that out there.
Thank you.
Yeah.
Thank you. I'm happy. I'm sure after they watch this interview, that some of them might want to reach out
Yeah.
um, but really thanks for the wisdom and just all you taught us today on this channel. Thanks for giving us your time as well. Any final thoughts about, maybe things that you would want to share that I didn't ask you today?
I don't know. You asked some really great questions. Yeah, I think that like as beginning therapists, whether you're like an undergrad or master student, wherever we are, it's really easy to get that like imposter syndrome and like I don't know what I'm doing here. Am I even going to be helpful to people? And I think what was really powerful for me when I was especially in my master's program of like being told like that means you're right on the brink of like the next thing. Like you have that protection that's coming up that's like, oh, I don't know how to get there. And if you can trust yourself and trust like you're here for a reason and have people, a community around you that's like, we got this together, like we believe in you, you're right on the brink of something really beautiful. So if you feel that, let it hang out for just a little bit longer and see what happens. Like what's the next thing?
Words from the wise GinaMarie, my friend. Thank you so much. Thank you.
You're welcome.
Yep. And,